Is this Senate bill basically still Obamacare in your mind?
Well, the Senate bill is not going very far, and it's not actually, in my view, a reform, something that takes away the entire Medicaid expansion, that hobbles the exchanges, is a way of trying to take down the essential positives of the Affordable Care Act.
So you believe basically it leaves the structure in place, although it backs off the long-term additions to Medicare over the years. Do you feel like, the other night we talked to Jonathan Gruber, he said basically, he was kind of pleased with this version because it is still Obamacare. Do you agree?
No, I think it's kind of like a neutron bomb. You remember it left the structures in place and killed all the people. I think that's one way of thinking about this bill. It gets rid of the 22 million people who had coverage while leaving a lot of the structures of the Affordable Care Act in place. That's not compassion. A lot of the House people voted for the House bill on the premise that the Senate would fix the bill. The Senate did anything but fix the bill. They did not make it more compassionate. It still threw off 22 million people.
What do you make of the argument that under the original Obamacare, 23 million people opted out of it? They either paid it, they paid the fine, or they avoided it, they ignored it, they didn't check off the box that said, I have no health insurance, and that now you're giving more people the option. Let me ask you a question. Now you're giving more people the option to decide whether or not they want to pay for their health care through this program.
Martha, let me make 2 points. Since day one of passage of the Affordable Care Act, I said that we are going to need revisions. We're going to learn about unintended consequences. We didn't get everything we wanted in the bill, especially efforts to control costs and reduce deductibles. So I've always said we need reform. I think we actually need a process of constant reform because we're learning new things as we go along. The second point I would say is if the American public has to understand one thing very clearly, if you want pre-existing conditions excluded, so insurance companies cannot exclude people with cancer or heart disease or diabetes or depression or asthma, you have to have everyone in the system. You cannot allow people to choose, I'm going to be in or I'm going to be out until I get sick and then I'll jump in. Those two things cannot operate at the same time. If we want no pre-existing disease exclusion by insurance companies, you have to have a mandate or some other way of getting everyone into the system. I know people don't like that, but that is inevitable. It is one of those things you have to eat your vegetables to make progress
that was
here.
one of the big failures of the program. I mean that's what we've learned, that you couldn't get young people to buy in because they only wanted to buy in once they got sick. So why should they put their hard-earned money into this pile if they don't have to do it until they get sick? Let me finish my point. Go.
But that's what would happen if you didn't have a mandate. They would sit on the sidelines until they got sick and then come in.
There's no. Under this program, the mandate would be gone. But basically, we're bailing out the insurance companies now. That's why you've got a nice boost for hospitals and for insurance companies, because now the money's all going to go to them to stabilize them.
Martha, there are things we can do to encourage young people to get into the insurance market. A lot of them don't know they're eligible for subsidies. A lot of them don't understand what the risks are without it. And I do think we need to be serious about enforcing the mandate and what the insurance companies have said. Reduce the number of exemptions and exclusions so that people actually have to come in and tell them we're serious about it. We also do need to stabilize the insurance companies, just the way Republicans stabilize the insurance companies under Medicare Part D, the drug benefit. You don't know who's going to be in the market. You don't know what their profile is going to look like. And so to keep rates down, you need a stabilization. But, the uncertainty created by this bill, the uncertainty created by the Republicans about the cost-sharing subsidies, those subsidies for the deductibles and the co-insurance. We're not going to enforce the mandate claim by the president. That creates a lot of uncertainty, and insurance companies increase the premiums. One of the reasons we've gotten a big boost in premiums is the uncertainty created by the Republicans.
All right. I got to leave it there, Zeke. Thank you very much.